I'm really excited about Malama Ohana and our working group, and Ho'oikaika is such a perfect place to discuss this because Ho'oikaika actually represents the kind of community-based solutions for child welfare that we hope our Malama Ohana discussions will create for us. So I am Laurie Tochiki. I am the executive director of Epic Ohana, and Epic Ohana is the lead agency for a network called Nakama Ahaloa that I'll discuss a little bit in, later. But just anyways, thank you so much for offering this space for Malama Ohana and for everything that Ho'i Kaika does and this huge community that is it is exactly that community-based discussions about ways that the community can be a partner to child welfare, and that's what Olama Ohana is all about. I am, as I said, executive director of Epic Ohana. Epic is a nonprofit organization that provides a number of services statewide, including Ohana conferencing, youth circles, family finding. We are the home of the Hawaii um, the Hawaii Youth Opportunities Initiative or High Hopes. And I do let me just share a PowerPoint that'll be our discussion today. So okay. So um Malama Ohana Working Group really comes out of our work over the last 5 years as the lead agency for Nakama Ahaloa. So Nakama Ahaloa is a network, and this concept of a network is really important because how we shaped our Nakama Ahaloa conversation is really what we're sort of envisioning for the Malama Ohana working group as well as a network. A network is an organization, but more a connection and relationships among individual organizations and individuals. So Nakama Ahaloa began in 2018, and the goal was to find ways that as a network we can improve the outcomes for Native Hawaiian children in the state of Hawaii. We began with conversations with Kamehameha schools and with Liliuokalani Trust, with Annie E. Casey Foundation and Casey Family Programs Foundation, and the Department of Human Services. And so we came together to talk about this concern for the Native Hawaiian children who are touched by the child welfare system. And so over the years, our network has convened many times, and we have started to develop a, a strategy, if you will, for improving outcomes for Native Hawaiian children. So our goal is is to weave Native Hawaiian wisdom and perspective into the foster care system, and to find ways that the especially lived experience um, can help improve outcomes for Native Hawaiian children and families in the child welfare system. The reason why we started the network is that Native Hawaiian children are disproportionately represented in the child welfare system. Um, and this, of course, is true in many systems that where families and children are touched. It includes, the juvenile justice system, the health and public health systems, and so this little chart shows you a flavor of that disproportionality. And it, of course, whenever we talk about disproportionality and statistics, it's always a little challenging to really capture ethnic differences. But in child welfare, the disproportionality also includes Filipino, Polynesian, and Micronesian families. This chart is specifically about Native Hawaiian families. So when we began our network and our network work in 2015, we started by having listening sessions, really by doing more than 40 interviews with stakeholders and individuals across the state, and we asked them to think about what are the needs of Native Hawaiian children and families in the child welfare system. We asked them to think about what needs to shift in order to have better outcomes for Native Hawaiian children and families. And so we came up with through these interviews, we came up with a list of about 20 what we call critical shifts, things that if the situation is this now and we shifted it this way, this might create the change that we want to see in the child welfare system. So some of the examples of critical shifts are the kinds of things that became the opportunities for our specific initiatives. So for instance, one of the critical shifts was that if families that have multiple siblings, if we could make sure that siblings are kept together and make sure that siblings have an opportunity to continue to connect and support one another if they're involved in child welfare, that shift might really help outcomes for Native Hawaiian children. Another shift might be if families could feel more connected to their Hawaiian culture and values, if they could reconnect um, and with an understanding of Hawaiian culture, that shift and really that shift of Hawaiian culture or culture as a protective factor would really make a difference to Native Hawaiian families and children. So that's the critical shift you see that we started to zero in on. So, with that, we started with group work, and so over the years, we picked some critical shifts that we wanted to really focus in on, and so we started with some committees that really started zeroing in on the critical shifts. And so we have a hui kauhale that worked on Native Hawaiian values and culture. This hui created trainings for the community, but more importantly, trainings for social workers about Native Hawaiian perspectives, and that training is now part of core training for every new social worker that comes into the child welfare system. Youth voice and family voice, that we really wanted to strengthen parents and parent voices because the parents are so important to the children. And by strengthening parent voice, we believe that we can also strengthen the system. Sibling connections, I talked about a little bit, keeping siblings together. Resource caregivers. And then this one, it's really the that if we can have resource caregivers or foster parents available and really strengthen their role for children and families even after children are reunited, or when the foster parents become permanent foster parents for permanent parents and new parents. And then Hui Hilo really specifically looked at initiatives in Hilo, especially for strengthening relationships between foster parents and parents. So that's the work that the network came up with, and this is the olelo that informs the Nakama Ahaloa network. And and so from that, 2 years ago in 2022, at a network convening, we really thought a lot about how might we take what we've learned in this network and bring it to the larger community and to all families in child welfare. And there was a lot of criticism and concern, especially after the disappearance of Arial and the concerns and grief that the community experienced. And so at that time, we proposed that a network like a network like Nakama Ahaloa, emerge to really discuss how might the community be a stronger partner with the Department of Human Services, and how might we really use what we've learned as a network to develop the develop outcomes, or proposals for better outcomes for children, all children in the child welfare system. So the that's how the working group began. And Karen, thank you for joining us. Just to give you some background, we only had Noreen when we began, and so now we just have you. But I'm going ahead and doing the sort of the presentation for the working group, and we're recording it, just so that we have the this wonderful opportunity that we've been given, to present about Malama Ohana. Um, so I'm gonna just continue with the presentation part of it that we're recording, and then we'll have some brief discussion. But I also appreciate that, because there are just so few of us, that maybe you understood if you want to go elsewhere. So, so that's how Malama Ohana began. We began in a network session, and Venus Rossetti Maderos, who's the other co-chair with me of the Malama Ohana Working Group, really came up with this idea that, we've learned so much by having the Nakama Ahaloa network, by really lifting up the voices of lived experience. And so we spoke with, in the 2022 legislative session, right toward the end, we spoke with Sylvia Luke, who was chair of the House Finance Committee at that time, and also the chair of the Senate, uh, the Senate committee that was also very interested in finding ways to support and find changes to the child welfare system. So Senator Juana Ventura. And so we proposed the Malama Ohana Working Group. It was passed by the 2022 legislature, but it was vetoed by the governor because of some other parts of the bill that included Malama Ohana Working Group. So when 2023 legislative session began, we were a part of the Keiki Caucus, part of the Hawaii Children's Action Network proposals, part of the Early Childhood Action Strategy Policy Committee proposals. And so we were able, in the 2023 legislative session, to pass the bill that established the working group. And at that time, we also asked that the working group be a part of the Office of Wellness and Resilience. And so very grateful that it passed the legislative session with so much support from the community. Unfortunately, it passed the legislative session without funding right at the very end of the legislative session, but we were able to secure the sponsorship of Kamehameha Schools and the Community Foundation, and so we're very grateful for that as well. And so now we've begun. So the working group outcome is to establish within the child welfare system trauma-informed, community-based partnerships and proposals that we will bring to the legislative session in 2025. And that those outcomes, that those proposals will have that community voice and the voices of lived experience, and find ways that we identify training needs, as well as workforce enhancement proposals, and that we build on Native Hawaiian cultural practices and community and other community values that can really strengthen the child welfare system. So that's where we are. So we had our we were able to establish the first members of the committee, and we had our very first working group meeting about 2 weeks ago. Here's a list of the members of the committee of the working group as established by the the legislature. So Venus Rossetti Maderas, who is also one of the founders or the founder of the Ho'oi Kaika partnership, and again that kind of illustrates the important connection with Ho'oi Kaika, is co um, chair with me. So the two of us are the conveners of the working group. We have two members from each of the following constituencies, and this is really important because what it means is that half of the organization of the working group are people with lived experience. So two birth parents, two former foster youth, two resource caregivers who are licensed resource caregivers. That means they are general licensed resource caregivers, and then two kinship resource caregivers. Um, and then we have the director of the Department of Human Services and that person's designee, who is actually um, Daisy Hartsfield, who's who's been appointed to sit on our working group, and then two members of the Department of Human Services who have experience as investigators, case managers, and assistants. And this is really important because we really wanted the people to be people who know what it's like in the trenches, if you will. So one is Lisa Raposa, who's from Kauai, and the other is actually Eladine Olovau, who's from originally from Molokai and of course served on Maui, and is now in responsible for the branch. Um, the chairman of the Trauma Informed Task Force, which is Dr. Scott Shimabukuro from CAMHD. We have the current executive officer of OHA is serves on the working group, and then we have Ka'anoi Wak, who's been appointed from Kamehameha Schools, and Chiami Davis from Liliuokalani Trust. So that's where we began. We are under the umbrella of the administration of the Office of Wellness and Resilience. So Tia and her group has been amazing in helping us get started. Although honestly, with the Maui fires, it's just been so overwhelming. And but we're grateful because the goals of the Office of Wellness and Resilience really are so much aligned with the goals of the Malama Ohana working group. Um, and we also have secured the services of One Shared Future. So Rachel Wong and Kavika Riley are serving as our facilitators, and that just got started and is also just the perfect uh, assistance that we need for our work. I wanted to just share this slide from um, from from the Office of Wellness and Resilience about the SAMHSA principles of trauma informed care, because again these are the guiding sort of perspectives, if you will, for for the Malama Ohana working group. And so when you think about trauma informed care, there are these hallmarks, right? So we want to make sure that the conversations are safe, that the principles and the ideas that we emerge really uh, promote safety. Trustworthiness and transparency is so important, that the conversations and the system and the proposals that we we come up with really create a system where there is trust and transparency. And of course, in Hawaii, that means relationship and honoring those relationships. Peer support is at the core, and that's the honoring the lived experience and the expertise of lived experience, and that's why that's right smack in the middle. The importance of collaboration and mutuality, which we really learned from Nakama Ahloa, is so important. That collaboration is key, and building the collaborative networks is really important. Empowering voice and choice, and then cultural and gender issues, and that really speaks to the cultural humility and cultural competency and cultural core that Paul also mentioned. And so I'm gonna actually stop sharing now and talk a little bit about how the working group will get started, um, and and then have a little bit of a conversation about what we're hoping to accomplish. Um, so so the working group is under the not control of, but the guidance of what's called the Sunshine Law. So the Sunshine Law means um, that whenever the working group convenes, it needs to have public notice and public notification of its agendas. And it also means that no more than two people can talk without that kind of public notice and agendas and opportunity for public input. And so that's why when we had our first meeting a couple of weeks ago, there was a notice of the agenda, and we dedicated half of the time to public input and public discussion. And we really want that, and we really want this to be, yes, there are these working group people, but really the decision making, we are hoping, will be community based and have that opportunity for everyone to give input. That said, though, we are planning to have our next steps be listening sessions. And so for the next few meetings, we will be discussing how to set up those listening sessions. We will be establishing what are called permitted interaction groups. These are smaller groups that can include not just working group members, but also members of the community. The and these permitted interaction groups will then start to really dig into the questions that we assign to the groups, specifically about subgroups, geographic groups, and they will be charged with holding and conducting initial investigative kinds of discussions, and then inform the larger listening sessions. Then we will also be aiming toward a large public convening in the summer, where we hope to gather a larger community in using kind of human-centered design kinds of principles. Some people call them design thinking principles. There are other methodologies for that, but a large convening, hopefully in person, but also with some virtual capability, that we can really generate the ideas that will become the recommendations to the legislature. So that's how we're going to go about it. That's our goal. And I guess what I'd like to do is just stop in terms of the sort of presentation piece of this, and then just have a conversation with Karen and maybe I'll share this last slide before we do that, and then we'll maybe stop the recording at that point. So the last slide I'm going to share, I'm going to go back to my sharing, and so these are some of the questions that we will start to unpack as we have our continued discussions in our working group meetings. We will be starting by really kind of zeroing in on what is the vision for this. We need to have discussions about focus and frame. Whenever we have a network, we have to think about what's sort of the edges of our conversation. When you talk about child abuse and neglect, when you talk about the child welfare system, it can be huge, right? So um, the 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 there's a whole prevention system. So where is the frame of our conversation? We're gonna talk about just those places where families touch the child welfare offices and the child welfare laws, or are we going to talk about the larger prevention system? And right now we're sort of zeroing in and kind of steering, if you will, toward those places where the child welfare system gets touched. In other words, when families start to experience crisis and problems and concerns. And then what is the focus? So you have a frame and you have a focus. And so those are some of the initial conversations that we need to have. We want to talk about what are the strengths of the child welfare system as we define that focus and frame, but then also what are the concerns and worries, and doing some sort of root cause analysis, the why discussion about, well, what are the problems, and like, for instance, when we start talking about workforce, what are some of the issues that really make it very difficult for us to sustain the workforce for the child welfare system, and what are some of the reasons why there are problems, and then we can come up with some solutions. Who has the answers? Who do we need to listen to? Where is the grief and the hurt and the pain, and what are the stories that we need to make sure we're listening to in the working group? And then, what are the ideas that are in the community that we need to lift up? Some of those ideas need to be legislated. Others ideas are already there and just need to be supported. And how might we as a working group support the initiatives that are already in the community? So there are going to be, as I said, monthly meetings of the working group. We hope to start the listening sessions in early 2024. There are opportunities for the public to become members of the permitted interaction groups. We are planning a larger convening in the summer of 2024, and there is a form on our webpage, which is www.malamaohana.net. So there's a form on the webpage where individuals can let us know about their contact information. And with that, we will be sending out all the notices of all the meetings, and also opportunities to become involved. So that's our website, and that's also where we're posting additional copies of the minutes of the working group meetings, recordings of the working group meetings. We'll be listing notices of listening sessions and opportunities to participate.